Hi everyone, I'm Dr. Anneliese Kaufman at the Geriatric House Call Dentist in Manhattan, here with the Geriatric House Call Dentist from Philadelphia and the suburban areas, which is a large area. Call her and she'll tell you if she comes to you.
Yes.
I want to talk to you about the dementia and Alzheimer's patient that has a lot of decay in the mouth.
Yes.
And maybe you're the second opinion and the first dentist says that they need so much work, crowns, bridges, fillings, and they can't do that. They're not able to sit for that. We have a solution. I want you to discuss it.
Sure, absolutely. So I use it all day long, every day. And it's called silver diamine fluoride, which is literally a drop that we can put on the tooth structure to actually stop the decay. And sometimes that's really important. We know we can't treat it, but we also don't want it to advance either. That prevents infections, pain, and that's really important in this population.
So we use a product called Arrest by Elevate Oral Care.
Right.
And I don't know of any other product, any other company that makes it. I use that one. And I like it because it's called Arrest. And what it actually means is that the cavity becomes arrested, stops.
Right.
So even if it's very close to the nerve, as long as it's not in the nerve,
That's right.
we put this drop onto the tooth. We don't drill it. Sometimes we don't fill it because they're too demented or they can't open if they have ALS and they can't open, but there's a cavity there. We just want to make sure that the cavity stops. And so it's arrested. And that is the most important thing. I call it fillings without drilling, but there's really no filling, but there sometimes can be filling.
Yeah, there's sometimes we can.
So if they can cooperate, we'll do the filling. But if they can, and again, with ALS patients, they can't open sometimes. With Parkinson patients, they can't stay still.
That's right.
We can't control the saliva. We can at least stop the cavity from getting bigger and causing pain or infection.
That's
so
right.
that's really important. And the other thing that we do all day long is make sure that patients' dry mouth is protected.
That's right.
So that can cause decay. So as I don't know what you use. I use a product called All Day. Do you use that?
I do as well.
And that's also made by Elevate, and I love it because
I do too.
patients ask us, how many times can you use it a day?
Yeah, all day.
All day.
Literally.
All day. That's why they call it All Day.
That's right. That's right. A lot of their medications dry their mouth out.
Mm-hmm.
And so that's a really common complaint is they just are so dry all the time. And this product is really the best one. There's a lot of products on the market. We love All Day because our patients love it. And it makes it so their tissues aren't so raw and it feels, wet. And that's what, saliva is supposed to do. But if they don't have saliva, we need to supplement it with something else.
Exactly. And don't tell Elevate, but I use it off-label because of its gel-like consistency. I use it on a toothbrush because you can then brush the teeth and swallow the toothpaste because you don't want to swallow regular toothpaste.
That's right. That's right.
So we love these products and we thank them for them because I don't know what we would do without it. I mean, it's very difficult, the swallow situation with the toothpaste.
That's exactly right. That's exactly right. I have many, especially dementia patients, that really, they can't swish and spit. They really don't understand that, especially if you bring a cup, they want to drink.
Exactly.
They want to swallow and eat everything. So we want to make sure that it's safe. And mechanically remove all the plaque, but then use the All Day for the gel to coat the tissues and make sure that they feel good.
So 3 squirts on the tongue, and the saliva is generated, the tongue carries it and coats all the teeth.
Right.
So it actually does a lot of things that off-label that they can't say it does, but I see it working.
Right. So that's the thing. The idea is to stimulate the salivary glands that are not stimulated enough because of the medication, right? So All Day will stimulate that to have them produce a little bit of saliva, make them more comfortable.
So in summary, I'd like to say that we can do fillings without drilling if need be. It's really important, and a lot of general dentists do not use this technique because the side effect, and the only side effect, is it will turn the decay black.
That's right.
So it looks ugly in the front of the mouth, but you know what? Sometimes that's not important because
right.
we need to just save those teeth from rotting. And we like to keep the mouth moist so that you don't get decay. So the All Day spray actually protects the mouth and keeps the tissues and the teeth moist.
That's exactly right. So when we see our patients, I know Alyssa does the same thing as I do. we give them the all day when we leave, before we leave, because most of them have dry mouth, and we try to do this arrest on all of our patients if it's needed.
So, more information to come. Listen to our other videos. Bye for now.